Hello, welcome to the presentation on concussion management and the return to learn process. I am Sonya Simons, a school psychologist at ESU8 and member of the BURST team. Assisting me in the presentation is Jill Bates, Assistant Administrator of ESU8 and a fellow member of the BURST team.
Thanks, Sonya. To begin this webinar, let's review what the Concussion Awareness Act is.
Well, in 2011, the Nebraska legislature passed the Concussion Awareness Act, which requires schools to provide education to coaches, parents, and student athletes on concussion, remove students from play if a concussion is suspected, and have clearance provided by a licensed healthcare professional before returning to play. The Concussion Awareness Act was amended by Nebraska legislature in 2014, and it requires schools to have a return to learn protocol in place for students who have sustained a concussion and are returning to school. They need to recognize that students have sustained a concussion and provide formal or informal accommodations, modifications to curriculum, monitoring, and communication between parents, medical staff, and students as the student returns to their academic learning.
So does the return to learn protocol apply to all students in all schools?
Yes, all students in public, private, or parochial schools are covered by this law.
What does the research tell us about concussion and cognitive activity?
Current research shows us that high levels of cognitive activity following a concussion can slow down or prolong the recovery. So students need to be provided accommodations by the school district that will implement a plan to make sure that everybody's on the same page in meeting the students' needs.
And the goal of this team is to safeguard the students' health and return them to learn or to play safely.
Oh, yes.
Okay, so what is the concussion management team?
It's a school team that's composed of family, medical personnel, school personnel, anyone needed to safely facilitate and set up a return to learn protocol. Essentially, you would have to have the members of a concussion management contact person, the healthcare professional that's working with the student who's diagnosed their concussion and is working on their treatment, school administrators and designees, or parents. It could include teachers, coaches, school nurses, the student if age appropriate, school psychologist, speech pathologist, counselor, occupational therapist, physical therapist, athletic director, and a burst consultant if needed by the team.
And I noticed that you mentioned that the family's personal health care professional is an important member of this team.
Yes, it's going to be critical for the teams to work together, the medical and the school, in communicating. The doctor may have recommendations of what he would like to see accomplished at school or at what rate he would like the student to return to learning. And it's going to be critical for the school to communicate back what symptoms they are seeing or if the student is symptom-free, etc.
Is there a recommended size as schools put their teams together?
No, basically this is going to be an individual team based on each person's needs. So you may have a 4-person team or you may have an 18-person team. It will be completely determined by the need of the student.
Does the team have a leader?
Yes, each school district will need to designate a concussion management contact person. This should be an individual who's at the school daily. It could be a SAT chair or an athletic director, teacher, maybe even an administrator, just as long as it's someone who's working in the school basically every day that it's open.
So if the contact person is notified of a suspected concussion, what are his or her first steps?
Well, you should try to get medical support and clearance through the parents. You should request or at least guide them to get a medical diagnosis and have it confirmed by a professional. We need to be careful. We can't require parents to do this because the school district could be forced to pay for that medical appointment. So we want to strongly encourage them. But any time that you suspect a student has undergone a concussion or might have a concussion, the school should feel comfortable that they can begin a return to learn process and make sure that they're supporting the student. Just err on the side of caution whenever there's a question.
Is there a form that the school should send with the parents to take with them to the doctor?
Yes, there is a medical form that can be completed by the doctor. It'll basically have the doctor sign off that they have been evaluated and diagnosed with a concussion, and it allows them and encourages them to provide us some recommendations. It specifically asks a few questions in regards to how much time at home or when they should have a shortened day. And it also has a release on the bottom, which will allow the school and the medical doctors to communicate as needed.
I noticed that another first step for the contact person was to look at the student's physical activity level.
Yes, the first thing you'd want to make sure you do is to definitely decrease any activities that the student's participating in, remove them from physical activities, PE, sports, if you're having a school assembly or a Halloween party, anything that you think could be physically stimulating and even cognitively stimulating, you just want to remove them from physical immediately.
And this would be information that families should also be aware of.
Yes, again, that communication is going to be so important. Sometimes we get kind of busy doing our aspects of the job, but we want to make sure we're communicating with parents all the way along, letting them know what symptoms to be aware of, letting them know what things need to be done at home for rest, and what we're doing at school to support their student.
So communication is important, and we've mentioned the form that the families can take with them to their medical provider. What are the other responsibilities of the contact person?
Again, they're going to be that facilitator that contacts the teachers, the school nurse, the athletic trainer, coaches, everyone that needs to know that works with the student. And it's going to be their job to kind of facilitate putting the team together, getting everybody on one page to meet and set up an individual process of return to learn for each student.
Can you expound a little bit on the academic progression?
Yes. The Bridging the Gap manual provides a return to learn academic progression that can provide a good sample layout for teams to follow. It kind of starts with the first situation where typically students are going to be at home getting some rest before they're coming back to school after a concussion. And it breaks it down into some progressions, starting with once a student has 30 minutes of time that they can maintain mental focus and exertion without having severe symptoms, they can begin to come back to school. And that just works through things that you might do like lunch in a quiet area. We know that the gym can be a very overstimulating time at lunch, quite loud, maybe modifying classrooms, etc., modifying homework assignments. And it works through the progressions, having you look at 30 to 40 minutes of symptoms, 60 minutes, can they work cognitively without symptoms, etc. Hopefully you will continue to just back down the supports that you needed as the student can tolerate longer periods of cognitive exertion.
As a student moves through this progression and is in the classroom at school, do you have recommendations as far as documenting what teachers see?
Yes, it's going to be important for the team to set up a documentation system, and that could be varying from district to district. If you have something you already use when it's necessary to communicate, maybe through your SAT team or etc., you could set up a Google Doc, just something to make sure that you're monitoring symptoms and documenting symptoms, looking at accommodations that you've put in place. Are they effective or not effective? What changes need to be made so that this can be communicated with parents and medical professional as well.
Is there a checklist that teachers could use?
Yes, another resource that's provided in that manual is the post-concussion symptom checklist. This can be used in a variety of different ways. If you notice or reported that a student has a concussion or you suspect a concussion, you could utilize this checklist immediately to kind of get a gauge of where the student's at, what kind of symptoms they're having or not having. It could be used throughout the process of returning them to learn, maybe monitoring them daily with it at 4 days out, 5 days out, as you see the symptoms decrease. Basically, it has several commonly seen symptoms, and it rates them on the students having none, mild, severe, moderate. So it's a really good check-in to see kind of what symptoms they're having and what severity they're having.
I do notice that this form includes a statement near the top that is directed toward the student who sustained the concussion that says, please indicate how much each symptom has bothered you over the past 2 days.
Yes, again, you can modify this checklist to work with your team and your student. If this is a high school student, it might be appropriate to simply have them complete this form. If it's a younger student, you might want the teacher to utilize the form and just question or give input, monitor the student, and complete the form. Either way, I would make sure that you work through the form on an individual basis. If it's a high schooler, make sure you work through it with them the first time and go through the form. Make sure they understand the rating scale. Make sure they know what nausea looks like for them or what would be an example of difficulty concentrating. If it's a younger student, you may have to tailor the questions that you ask. Nausea may not be commonly understood by a first grader. You might have to be a little more specific about what an upset stomach might feel like to them.
Are there best practices as far as using documentation?
Yeah, again, it's an important means for informing everybody on the team, the teachers, parents. So you're going to want to set up kind of a narrative form, a method, either a Google Doc or something that everyone can provide input on. And the team is going to really want to talk about how often should this happen, what's going to be our documentation system. Best practice recommends about every 30 minutes to an hour, the first day or two back to school, someone would check in. And you can gradually decrease this time as the student is showing symptom-free, or you can back out how many check-ins that you do. But the first couple days, you really want to be monitoring them closely.
So what types of symptoms should teachers be aware of?
Well, there's physical symptoms like headaches, blurred vision, balance problems, dizziness, again, the nausea and the vomiting that we've talked about, sensitivity to light. Sometimes the school fluorescent lights, etc., can be very bright and stimulating to students. Sensitivity to noise, such as the gym or any lunchtime, disorientation.
And of course, teachers would be looking for cognitive symptoms as well.
Yes, this is definitely an area where teachers' personal knowledge of the student is going to be beneficial. When you're working with a student day in and day out, it might be easier for you to notice symptoms that they're not clearly picking up on. You might notice that they're having trouble concentrating, difficulty staying on task, or new instruction that you're providing, they're not able to remember the steps, slowed processing speed, they may not answer questions at the same rate that they used to when asked. Overall, any reduced academic performance that you notice is different from their typical day.
And I do know that oftentimes people who have sustained a head injury, including concussion, have some difficulties with their emotions.
Yes, again, with your knowledge of the student, you're going to want to be careful and just look for any changes in mood or any increased emotions that a student typically doesn't have in their normal temperament. They might be really irritable. They might typically be somebody who gets along well with everybody, but they're very short-tempered with everyone and irritated quickly by peers. Any anxiousness or anxiety, just any increased or varying emotions.
Do students with concussions have sleep disturbances ever?
Yes, and that's another area. We'll want to communicate all these symptoms with parents. There'll be a good resource in asking them questions about the students' sleep patterns, if they're sleeping more than normal, or if they're requiring less sleep, if they're up at night pacing when they're usually a sound sleeper. You may even notice a student falling asleep in class during lecture that just typically wouldn't do that.
So after teachers look at the physical symptoms or some of the other symptoms that you have mentioned, and they're doing their documentation, what are the next steps for the concussion management team?
Well, they're going to design that plan that's going to be a different fit for each student, and it's going to be modified probably as the student moves through their progression of recovery. And they're going to coordinate with the SAT team, et cetera, to make sure that any accommodations that are needed academically are put in place probably for about 2 to 3 weeks. Typically, in general, most students are going to recover in that amount of time. They need to review the progress with the family and the student and any medical personnel that they need to communicate with on that. And monitor the accommodations. Just work on adjusting the plan as needed to fit the student and their rate of progression to recovery. Then once the student is back to baseline and is back to normal, they can return to full-time academics.
And what does the team do if the symptoms don't subside in that 2 to 3 week period?
Again, it's going to be important to keep up that parental and medical communication. Medical steps probably will need to be taken to address concerns if the student is having prolonged recovery time and isn't showing any improvement. And the CMT team will just need to work with the SAT team to develop a plan for further accommodations so that we support that student while we're working them through their recovery time.
What are some of the possible accommodations?
You could reduce the student's workload by decreasing their homework or allowing a later start to the day, or maybe they need to leave earlier. Your symptom checklist might be a good clue on some of these. If you're noticing teachers reporting a lot of headaches during the end of the day, you might decide that a student needs to go home a little bit earlier due to rest or cognitive overload need. Allow breaks if they seem emotional or tired. Let them put their head down or maybe even come out of the room to a quiet area where they could get some rest for a while. Allow them extra time to complete assignments, avoid tests or large projects. When a student has a concussion, it would not be the best time to do it MAPS assessments or state testing. Allow buddy notes. Don't penalize them if they have late work. And try to avoid band, music, lunchroom, any overly loud or stimulating areas, any large assembly that you might be having. You could even allow sunglasses to accommodate for bright lights in school.
I heard you say earlier that screen time includes not only computers and iPads and cell phones, but also the TV.
Yeah, exactly. You need to initially limit the screen time that students have. And this is another thing to make sure parents are communicated with. A lot of times when we come home to rest, we include TV or iPad time, and that's definitely not recommended for a student who's had a concussion. You're going to want to limit screen time immediately and then slowly bring that back in as the student is decreasing in symptoms.
If a concussion management team wants some additional information, where are some places that they could go?
Well, as mentioned, some of these forms were taken from the Return to Learn Bridging the Gap Concussion to Classroom from Nebraska Department of Education. And that is a form that is available on our website where you can download an entire manual to provide guidance as well as individual forms such as the doctor release form or checklists of symptoms for parents, etc. Also, the Center for Concussion, Rocky Mountain Hospital for Children, you can do a Google search and that will come up. And she provides some really good resources on that site if the team has a specific question that they're seeing cognitive overload in ability to learn new material, etc. She will reference some specific accommodations that can be used for various symptoms.
And an easy place to go access this information is at the ESU8 website.
Yes. You can go to the ESU8 home website and go to departments, and either through the special education department or the nursing department, you can access the burst page, which will provide you the manual. Or you could do a search on our site. Just type in burst, and again, you'll see the burst page and materials and resources.
And this is the manual that you just referenced.
Yes, I would recommend that each school print one of these off and have the opportunity to look through the entire manual. There's some good resources in there as well as several forms that'll guide your team in putting together a return to learn protocol.
As your team reviews this documentation and reviews the manual, if you have additional questions, you may contact either Sonya or myself. Our email addresses are right there, or you can just give us a call at the ESU8 office. As we wrap up, Sonya, do you have any final comments that you'd like to make?
I would just really like everybody to have a chance to look through these materials and put in place their concussion management person so that we can help facilitate a return to learn protocol.
Okay, thank you. And just as a reminder, the Wednesday webinar next week on November 19th will be Preparing for Hour of Code, presented by Heidi Rethmeyer. And on behalf of ESU8, thank you very much for joining us today, and we'll see you later.